Here we present a case of a balloon angioplasty for in-stent stenosis using a distal filter protection. The patient is a 74-year-old gentleman who had symptomatic left internal carotid artery stenosis that was treated with carotid stenting angioplasty about 4 years prior to his current presentation. Currently, the patient is asymptomatic, but on routine yearly carotid Doppler surveillance, it demonstrates significant increased velocities. The left internal carotid artery velocity was 280 systolic over 137 diastolic. He had past medical history, hypertension, carotid artery disease. Even though the patient is asymptomatic, a significant stenosis within the stent could cause decreased cerebral blood flow and could potentially cause stroke or TIA symptoms. The patient is bringing to the angio suite and the plan is to perform a balloon angioplasty. Here we obtain standard access through the left femoral artery with a 6 French guide catheter. Once we obtain access into the common carotid artery, we obtain distal access through the in-stent stenosis. Once we pass the microwire into the vitreous portion of the carotid artery, the next step is to pass the distal filter. We are going to park the filter at the level of C1 or maybe C2, as you can see now. Now the filter is being deployed successfully. At this point, we bring the balloon angioplasty, and as you can observe here, we inflate the balloon slowly and maintain the balloon inflated for at least 30 seconds or until the patient tolerates. You can observe here how the patient moves, and it's because all these procedures are performed under general anesthesia. That allows to continue neurologically examine our patient. Once the angioplasty has been performed, we deflate the balloon and we check the lumen of the stent with a new device, which is the intravascular ultrasound or IVUS. This device allows to observe the lumen of the carotid artery and inside of the stent, looking for possible debris or residual stenosis that might require a second angioplasty. As you can see here, the stent looks great and it's now well open. There is no more in-stent stenosis. And then the last step is to recapture the distal filter device, as demonstrated right now. Final carotid angiography demonstrates significant improvement of the in-stent stenosis.